I mean, if you're going to be a doctor, then do it because you want to help people.
I mean, even after you go through all these years of school and you're like, yeah, I'm going to help people. So let's say I go and work in a rural area in Texas for 3 years, pay off my debt. But then I keep working there for another 10 years. I'm going to get worked out because, I mean, I'm tending to, let's say, like hundreds of patients. And if there's not enough doctors that can alleviate my pressure to work in those community areas, then I'm going to leave and say, you know, I don't need this. I can go work in a hospital and earn, you know, twice as much as I'm earning right now. So, you know, you have to provide for yourself too.
Like, it's not even when they're practicing. They just go through med school and they see what the environment is like. They just get, they're not in it for the right reasons anymore.
It's a very difficult situation to say, oh, well, doctors don't go in it for helping people. Because personally, I want to help people, but at a certain point...
But you have to pay back loans.
Exactly.
I'm one of those people that I'm on the doctor route, or that's what I'm interested in becoming. I have a lot of those friends. We've talked about it. We want to go to countries like England or France where they have universal health care because we don't want to have to worry about turning anyone down. We never want to be faced with that because all we want to do is heal people. We want to make them feel better. We want to make them healthy so they can lead more productive lives, and we want to leave because of all the bureaucracy. It's that I don't feel like it's on the doctors. I feel like it's on all the madness that happens behind the scenes.
In general, people in med school do come in with the right intentions. They come in and they see a system. They're doing their rounds. They realize they can only see a patient for, sorry I can't see you, but they can only see a patient for 2 to 3 minutes, and they really can't have the impact that they really want. And that's when they become disillusioned. I think that's what Shashank is going to be writing about. So, I mean, I feel like, you know, maybe medical education is also to blame. You know, there are a lot of schools that are going towards cutting down the curriculum, giving people more time to actually be in the hospitals, do volunteer work. One of the requirements to go to medical school is to do the substantial amount of volunteer work, to give back to the community. You don't have that opportunity in medical school anymore, so you lose that fervor, that sense of commitment to the community that ought to be inspiring you throughout medical school the rest of your life.
As long as we can all agree on an ideology or ideological basis that people deserve care for the least amount, and
who doesn't want that?
And I mean, I don't know if you agree with this, but I don't think it should be a profit-based system. I'm all for making profit. Personally, I'm personally involved with nonprofits because that's how I like to go. That's how I'm a nonprofit guy, because I'm more into serving than making a profit, and hoping that I'll be happy enough in what I'm doing and I'll make a living at it. I mean, that's my goal, and we'll see from there. But we have to start from that basis. If we start from this is not about profit, this is about making people well and keeping them from being sick, then I think everybody can come together and talk from either side of the aisle. But if we're talking about, I want people better, but your concern is, I want more profits, people will take care of themselves, the free market will take care of themselves, but I want more profits, then it seems like you're not even going to start at the same place, you know? And if you're not starting at the same place, then you can't possibly come to, you know, if you're not starting the same baseline, it's so much more difficult.